Hey ladies, let's talk about continuous glucose monitor and why I recommend it. And I don't just recommend this for patients with diabetes. Continuous glucose monitor basically is a machine that checks your blood sugars pretty much when you're doing anything. You could be just walking, you could be just talking, eating, whatever. But what's great is the information that it gives you. Now, a lot of people are not a fan of it. People just think, well, I don't want to know. Well, you don't know what you don't know, right? So it personally was a life-changing thing for me when I wore it. It really showed me how my body uses sugar, or what happens with my body when I eat certain things, what happens when I stress, that kind of thing. So if you have insulin resistance, you're not sure if you have insulin resistance, you are gaining weight for no reason, you're not really sure why, or you just are curious, then I highly recommend that you get a continuous glucose monitor or a CGM. Okay, if you're a patient of mine, you know this because I absolutely recommend it for everybody. So the first thing is you got to make sure that you set it up properly. Sometimes I'll have women come into the clinic and they have numbers all over the place, or their blood sugars are super low, but symptomatically they don't look like they have low blood sugars. So that tells me it wasn't set up properly. So the first thing you need to do is you need to purchase something that's FDA approved and something that is either a prescription. There are some better ones now that are not prescription. The two that you can purchase, and I'm not advertising for any company or anything, but Freestyle is one company, either the Freestyle Libre or the Dexcom. And then you need to download an app on your phone and sync it to that device. Now there's different kinds, so you have to figure out which one it is. Then you need to give it time to calibrate. Okay, you need to wear it for some time to get the information that you need. So I'd recommend wearing it for about a good month. And most times, if you're just curious about what your body is doing with sugar, then you can just wear it for about 30 days. That'll give you enough time to really figure out what's happening in your body. Then the next thing is, what do you do with that information? First thing you need to do is understand, my goodness, there are some beautiful places here. I just have to stop and show y'all some really great properties here with so much space. The second thing you need to do is understand your numbers, right? So when we're looking at high blood sugars, 70 to 90 is considered great for fasting. So if you're not eating anything, your blood sugars are between 70 and 90. Now this, to be very honest, I personally start to look at your numbers when it's on the higher end of that range and you're fasting. I start to wonder that your blood sugars are already creeping up. So it really depends on the provider that you go to, but I'm very particular about those numbers when they start to get higher. Now, after you eat, your blood sugar is naturally supposed to go up, right? So they shouldn't be spiking to 200s and staying there, okay? So it's normal for them to go up, but it should come right back down, okay? And it should go back down within 2 to 3 hours after you eat, okay? So now that you have some of the information about how to understand those numbers, the next thing is to figure out what might be possible triggers of high blood sugars. So the first one for my beautiful women is sleep, poor sleep. Even one night of bad sleep, I can tell you for sure. For me, when I don't sleep, I feel sluggish the next day. Definitely my sugars spike. I'm hungry the next day. Stress, which raises your stress hormone cortisol, that will also do it. Your body thinks it's in fight or flight, so it's trying to make sure that you have enough fuel so that you can run from that tiger. The other thing, ladies, menopausal hormonal shifts. If you're in perimenopause, this is where we struggle the most. Why women don't lose weight. Those hormone shifts really mess with you. Lower estrogen equals inflammation, equals stress. That increases your cortisol, insulin, high glucose. If you're skipping meals or over exercising, that's something else that also causes high blood sugar. Dehydration, not drinking enough water. A lot of people don't drink enough water. They think they're drinking water, but they're not. You need to be drinking plenty and plenty of water. Aim for as much water you can drink. I mean, there's lots of different theories about what's normal and what's not. Drink. I say the best thing you can do is get the largest container you can have with you. And this is something that's personally worked for me, is making sure that I have access to that, bottle, and it's sitting right where I am. 2 liters, 3 liters, whatever you can contain in your space. And make sure you're at least finishing that in a day. Okay, so now we've talked about how to set it up. We talked about how you understand your numbers. Now we talked about the triggers. So now, what should you focus on? Here is the problem with women sometimes. We women are complicated. We try to make things complicated anyway. You need to watch the silent spikes. This is the one that sneaks up on you and you're not really sure what's happening. Look at those things that are labeled healthy, gluten-free, but they are loaded with hidden sugars. Your protein bars, coffee creamer, a nightcap that you went and you had that small glass of wine. All of those things add up. So think about this. If you are trying to lose weight and you're saying, well, it's just a shot of wine or a glass of wine or a shot of vodka or whatever. These are just little things that add up over time. Sneaky culprits, healthy granola bars, acai bowls. Now, I'm not saying that these things will make your blood sugar spikes. That's the reason why you need a CGM. A CGM will show you what in fact is spiking your blood sugar. Then I want you to pay attention to what happens in the morning. What happens to your body in the morning? What happens to your blood sugars in the morning? Are they spiking? If you're waking up in the morning and your blood sugar is 100, you might be experiencing what's called the dawn effect. It's a sign of hormonal shifts or late night eating. So what I want you to do is stop eating 3 hours before you go to bed and see if that changes anything. Now, I don't want you to focus on these numbers and try to be perfect. That's not the goal. Remember, this is just information. That's what we're doing in this first 30 days. I want you to look for trends. Look for trends. Look for patterns. Do certain meals spike your blood sugar? Does stress at work make you crash by 3 p.m.? So this is the roadmap that your body is giving you. Look for those patterns. That's what's going to help you out. So this is the roadmap to losing weight in 30 days, okay? I want you to use that CGM to help you shed some weight. Don't focus on too many things at once. Find a pattern. Pick one. And then test one change at a time. If it's sleep, I want you to focus on sleep. I want you to focus on maybe getting more sleep. If you're just doing it by yourself and you feel like you need help, try something to help you sleep. Magnesium is a good one. Ashwagandha is a good one. Do not take antihistamines like those Benadryl and things like that. Those just wreak havoc on your body, especially older women. Don't do that. Swap out your proteins. If you're an oatmeal eater, try proteins, eggs, fiber, and these are whole grain. Again, it differs for each of you. I can't tell you specifically what you should be eating. Try different things out, okay? Walk after dinner. If you notice that your blood sugars spike with certain meals, try taking a walk after dinner. You know, it doesn't have to be a long walk. It doesn't have to be a stressful walk. Just walk. Add magnesium glycinate before bed. And then check your CGM. Check it to see if the changes are working. So, last but not least, I don't want you to try to do it all by yourself. If you're getting frustrated and you feel like it's not working and you need some help, this is where your provider comes in. But I'm giving you this information because it can empower you to at least start to make these changes on your own. And if you feel like it's not working out, or there's some things that might be complicating the whole process, then definitely reach out for help. You know, I am hosting a live webinar where I'm going to be coaching 10 women on June 8th. Listen, if you are frustrated and you're trying to figure it out all by yourself, this is the time for you to switch things a little bit. Okay, I'm hosting, it's going to be just 10 women because of the coaching session. It's going to be a little bit time consuming, so I can only hold 10 women. So these are women who are ready to change things around. You've tried it all. Maybe you've even tried some of the things that I'm telling you to do and it's not working. Then it's time for you to get some help. Comment webinar, and I'll definitely send you some more information about that. Comment webinar in the comment section, or you can DM me webinar. Okay, ladies, I have come to the end of my walk, and it was so wonderful. It's so great to be out here in the sunshine. I'll talk to you ladies soon.